Like all of today's reports, except mine, it was extremely interesting, and now we have Professor Pierangelo who is a full professor at University of Pavia, who will talk about the ketogenic diet in epilepsy and neurological diseases. Good morning. Thank you all for being here. So we'll talk a little about the perspective of the ketogenic diet in epilepsies and in GLUT1. And then, for the last 2 or 3 slides, I will make it a little more discussive and discuss with you of what the problems are. I think I have a long-term experience because in 2019 we will celebrate 25 years of ketogenic diet in Pavia. So it has been a long experience that was in some ways also painful, because it is an experience that surely found on its way a series of hitches and a series of difficulties that are not yet completely solved. We will then discuss them in the second part. Why do you need an alternative therapy or a further option for epilepsy? Because you can see from this slide that 36% of epilepsies are not controlled by traditional medicine, and despite trying a second medicine, a third medicine, and other ones. And this is an extremely important argument. 36% of epilepsy is a lot. And it is even more if we think that when I started, now 30 years ago, the unchecked epilepsy was about 35–40%. And unfortunately, in these 30 years, the pharmacological research has not brought to a radical change to modify this percentage. If you think that 30 years ago, children with leukemia, 20% of them were cured and 80% died, now the percentage has completely overturned, so 80% are cured and 20% die. There is something wrong in the field of epilepsy. But another problem is having a drug-resistant epilepsy is a huge cost for the state. Here you can see that the annual cost for a person who has a drug-resistant epilepsy is almost €5,000. And of these almost €5,000, 2,226 is spent on a so-called second-generation drug. So having a person with epilepsy means an enormous cost for the state. Not managing to solve the epilepsy means that there is a suffering for the family, a suffering for the person, and a huge problem for the state. Therefore, an alternative could be extremely useful, and these are the direct costs, and we're not talking about the indirect costs that has the family, the work environment, and the whole situation that revolves around the patient with epilepsy. So one of the options that unfortunately is not much used in Italy is the ketogenic diet. I won't summarize the history from this slide because Professor Paoli has done it already, but I think that the ketogenic diet can now be considered. As you can see, it is used practically all over the world. One of the options that must be used, as the English say, as soon as possible. But the Italian situation is very different from the American one. This boy here is Charlie. And Charlie is a lucky boy because he had a drug-resistant epilepsy. He had an epilepsy surgery that didn't help. He then met John Freeman at the Johns Hopkins, and his luck is that John Freeman gave him a ketogenic diet, and this diet changed his life. But if Charlie has been lucky, the same is for John Freeman, because this gentleman here, Charlie's dad, was a Hollywood producer of this lady, Meryl Streep. And with the money raised through the support of Meryl Streep, and that you can see still goes to the events to raise funds for the ketogenic diet, he founded the Charlie Foundation. And this foundation offers a lot of money to my friend Eric Kosov to manage the research of the ketogenic diet and to have a ketogenic diet center that is the first in the world. From this, the guidelines are derived. As you can see, that is thanks to the Charlie Foundation that has set up this collection of the best or alleged best people in the world dealing with the epilepsy, and through these funds there is the interest in the ketogenic diet of thousands of publications. But according to these indications, and according to the indications that came out in 2015 on Epilepsy, which is the official journal of the International League Against Epilepsy, in reality it does not take much to make a ketogenic diet. It is important to have a neurologist, preferably who knows the ketogenic diet, minimal lab tests, and that the patient has a vitamin supplementation. So in fact, we can say that the tools and the environment for which the diet can be put in place is not so complicated. But at what point are we in Italy? As Professor Tagliabue has already shown, we have produced Italian guidelines, and these guidelines have served to pay more attention and greater, will of Italian doctors to be able to make the ketogenic diet. But in my opinion, they are not enough, and at this moment the situation is not the optimal one. Above all, we should have in mind a diagram that when a person has used 2 medical treatments should be is defined always for the definition that has been given by the International League of Epilepsy, such as a drug-resistant epilepsy. So at this point, we can give another medicine, and give another medicine, and give a quarter, and give a fifth, and give a sixth, and give a seventh. But we could instead use alternative therapies, and usually in Italy, you take the street. The other day, I saw a lady who has been treated in a hospital in northern Italy, who came to me to make a ketogenic diet after taking 21 different medicines, and another lady who came to me to make a ketogenic diet after taking 23 medicines. So I always tell these ladies that my name is Pierangelo and it's not Pio, because if it was Pio, maybe I could solve the situation, but being Pierangelo, it is difficult for me. But the situation is that one arrives at a ketogenic diet not after 2 medical treatments, but after 20 medical treatments. Let's talk about the indications of the ketogenic diet in the neurological field. The first indication is the one of GLUT1. Why is the ketogenic diet the elective therapy of GLUT1? Because, as you can see from the scheme, the glucose doesn't pass here. As the glucose doesn't pass, all the mechanism that produces energy is interrupted because there's no petrol, or the petrol isn't missing completely, but there's a deposit of petrol that is very minimal. Just to be clear, if I give the GPL, I have petrol and GPL. At a certain point, when I finish the petrol, the GPL intervenes and the car never stops, okay? This is a scheme that we've done a few years ago to make a diagnosis and then the treatment of GLUT1 and the radiant treatment of GLUT1. We have now made more than 30 patients and the results are splendid. We have 2 patients that have interrupted the diet. One is a girl with complicated family history, with a series of unspeakable misfortunes that have not allowed her to continue to have an attitude of attention to continue the diet. And the other one is a teenager who prefers the panzerotti of Lecce to the ketogenic diet, and we cannot make her change her mind. But all the others have continued the diet, and we also have a father that at 40 years old started the diet and is progressively removing the medicines. So these can be 3 types of approaches that can be done in the GLUT1. But what is important is that there is a team of work, and this family-centered team work in which there are a lot of interactions of various figures, and this is the best way to bring forward the diet in all fields, but in particular in the GLUT1. And this has led us to extremely interesting results. So we're now studying with American colleagues and Italian pediatricians how the metabolomic profile can be, because it could be that from this metabolomic indication we could have a profile of the person and have a greater or lesser response to the ketogenic diet. And being able to get results from this metabolomic study, we could have a profile that can predict a better functionality of the diet. But even more interesting, the appearance of the neurophysiological characterizations. As you can see, the patients after 18 months and after 36 months of diet have, for the most part, a growth of the IQ. This is amazing, and those who have not had it at 18 months have it continue the diet after 36 months. As you can see, this patient hasn't had it, but then he had it after 36 months. He had it, and then even more, it has improved after 36 months. Didn't have an improvement, but has improved after 36 months. It means that the diet gives a supply of energy sufficient to what the brain needs. It means that even beyond the disappearance of the crisis, beyond the movement disorder, beyond the clinical symptomatology, there is an improvement in the cognitive abilities of these people that guarantees them to have a better life, and this is what really matters to us. This is then the clinical trial on which we should start on the coming months that could become an alternative in a future diet. But with this, we still haven't started with the clinical trials, and we'll talk about it in a couple of years when we'll meet again. However, the further precise indications for the diet is the epilepsy. Does a most useful epilepsy form with which is more suitable doing the diet exist? Unfortunately, such a precise indication doesn't exist. There are some articles with indications, with experiences, especially in South America, on the fact that the Dravet syndrome responds very well to the diet. But unfortunately, we haven't yet got a precise indication on which type of epilepsy and what type of diet to follow. But especially with epilepsy is more suitable for the diet. In our approach, the effectiveness has been widely demonstrated, and also in American experience is very high, because there is a 7% of seizure-free, a 20% of people who have had more than 90% of resolution, and 23% of people who have had a resolution of over 50%. So we are at a 50% of response, and we will see after our data. But in Italy we can't find it, and we can ask ourselves why. What is our approach? Our approach is one of the works we've done in the last few months, and it's always centered on the patient. But as I've shown before, it is a type of approach that must rotate around the patient with a series of interventions from a team, not from one person. There is no ketogenic diet with the individual. The ketogenic diet exists when done with a team. And the neurological evaluation is important. So you have to have a neurophysiatrist for the ketogenic diet. In the same way, even more important than there is the dietary team. But it is also important that there is a dedicated nurse for the ketogenic diet, someone who solves all the paperwork, all the bureaucratic matters, which often stop or prolong the start or the maintenance of the diet. We have just started a diet with a girl from Padua, and she just got back to the pharmacy with a series of requests and clarifications. If I didn't have a nurse, a person that is good and knows the subject and helps me in all these things, I would waste a lot of time and would consequently do less diets. As I said, our experience has almost 25 years, but in 25 years we have made 140 patients. Why do I say but? because I think that my friend Kosov does 140 in a year or two. And the other very serious thing is that the beginning age of the diet is average of 123 months, and the history of the disease is 96 months. So as I was saying earlier, they don't come after the second medicine, after the third medicine, but patients come to us with 68 out of 113 with multiple daily crises, with an encephalopathy that have used at least 4 or 5 medicines. So the real problem of Italy is that we start too late, and with patients not in a generic drug resistant, but in a super drug resistant, and clearly does not allow us to have the results like in America. So at 12 months we have 6% of seizure-free, 14% which have a reduction of more than 50%, and so our result is much less effective than the Americans. But if you think about the therapeutic trials of the new anti-epileptic drugs, you have results that are overlapping or even lower than these. The latest anti-epileptic drugs that have been marked have a percentage of seizure-free that is around 10% and have a percentage of crisis reduction above 50%, which is around 20–25%, for which there are huge costs of experimentation, huge costs of production and marketing of drugs, with results that are superimposable to those who obtain in the several encephalopathies epileptic. Among these epileptic encephalopathies, just to try to find an aspect that could lead to an indication, there is a group of patients that are particularly good, those with a malformation of the cerebral cortex extended, for which are not operable or that have some focal dysplasias in eloquent areas, for which they cannot be operated. And these patients are especially better despite having an epilepsy that is severely intractable. They have a good response. This is the EEG of a child with a microencephaly before and after the diet. So let's see if the diet with all these qualities will also have side effects. You see that the suspension of our patients is for the most part given by patients who have suspended the diet due to the effectiveness or inadequate compliance, but for real and important side effects are really very few. So let's get to the conclusions that are also some of the questions. The first problem is that we must start earlier. Even in Italy, they don't have the capacity to put in our medical handbook, as we could say, the ketogenic diet. We will not have results that are superimposable for those of the rest of the world. But in addition to this, we must try to identify biomarkers as we're doing these studies, which may be directed towards a choice of a patient that can be a better candidate, and this could also be done with genetics. You know that the arrival point of the medicine, for those who will work after me, because I unfortunately will not be able to see it, is called precision medicine, having a genetic typing with both the type of disease, both possible side effects, both of the possible problems of a pharmacological therapy. This precision medicine is what will be the future as treatments of all diseases, but in particular of epilepsy. And we should have a precision medicine, both genetic and biohumoral, also of patients on the diet. And then, I think that in Italy, they should improve the knowledge of this therapy and improve the knowledge of the dietary aspect, but also the knowledge for neurologists and neurophysiatrists. If one sends me a patient after 21 medicine, it means that he doesn't believe in the diet, but he believes that he doesn't know what to do. So he sends the patients to Vigiotti. And this is not a scientific reasoning, and it doesn't bring to anything good. And then it is clear if we, a connection centre, meet with all Italian connection centres, and I fear that from the calculations and the survey that is going to be done in these days, we won't have in Italy 300 people that follow the diet. It means that there is something wrong, something that needs to be improved in knowledge, and to do this we need to overcome the prejudice. But in my opinion, what actually lacks is a connectivity between all the centres for the diet that in Italy there isn't at all, or there's very little. We must have a team game, so a person that lives in Reggio Calabria doesn't have to go to Salerno, that is perhaps the nearest place, or often goes to Rome or to Milan to make the ketogenic diet. It should be done in selected centres that use the same protocol, and there is already a protocol, so it hasn't got to be invented. And there has to be a will to make the diet to help the patient. But this connectivity should also be between doctors and patients, giving patients a greater availability of time and also different tools to change the diet, to be able to vary the diet, to be able to give them a compliance that is facilitated, to help these people to live their everyday life. And these things we're still very poor. We are trying, and also the association are trying, to create apps to help people improve their daily life with the ketogenic diet. This will certainly help, but it will help even more to have more specialized teams dedicated to the ketogenic diet. Because if we don't do like this, we will always remain suspended, and it wouldn't be good for anyone. And with this, I conclude, and I thank all those who support me and stand me every day. Thank you very much.